Hey everyone, I'm Dr. Jacobson, your go-to board-certified plastic surgeon right here in sunny Beverly Hills. Buckle up because in my practice, I've seen it all. From jaw-dropping transformations to some truly unforgettable procedures. It's been quite the journey and I can't wait to share it with you. Join me on the Beauty Blueprint, where we'll dive into cutting-edge procedures and techniques in the world of cosmetic plastic surgery and explore everything you need to know about the overall health and wellness. But that's not all. I've lined up some exciting guests who will share their insights on various aspects of health and beauty, making every single episode packed with valuable information and fun discussions. So grab your coffee and get ready to join the conversation every Sunday morning at 7:30 a.m. right here on Go Country 105. You won't want to miss a moment. Good morning, Go Country listeners. We're back with another episode. We're so happy to be back here again.
Yeah, I'm so happy to be here. Happy Sunday, guys. It's a beautiful morning. So happy to be here. Yeah, so we got so many phone calls last week, our myth versus fact. We just had a ton of questions. A lot of those topics that we covered were genuine questions that people call in for consistently. So we're here today to dive into round 2 of myth versus fact.
Yes, let's do it. I think this is going to be very helpful for our listeners.
Yeah, absolutely. Let's get into it. Okay, so myth or fact, all plastic surgeons are the same.
That's a myth. So the trainings can be very variable and they can emphasize on different aspects of plastic surgery. Some emphasize more on reconstructive and some on more cosmetic, some more on facial surgeries and some more on body surgeries. For example, you may have seen plastic surgeons who say they are facial plastic surgeons. So their training was specifically in facial plastic surgery, whereas there are other plastic surgeons who did more training and their specialties in the entire body. So not all plastic surgeons are the same.
Wow, I didn't know that actually. Yeah, I just kind of assumed that plastic surgery is plastic surgery, but you're right, that makes sense why there'd be different kinds. Yeah, that's a great one. Okay, myth or fact, plastic surgery results are always obvious.
That's a myth. So number one, if your surgeon is talented and you ask them for subtle results, you can get results that are not very noticeable, but people just say, oh, you just look better overall. So yeah, that's one. It's not, a lot of times it's not going to be obvious. Number two, a lot of times patients come right out of surgery and they think they're going to be all done and they're going to be they're going to look the way that they want it to. And as I always tell them, it's not IKEA. We're not putting just a bunch of pieces of wood together and screwing them. There's going to be a lot of changes that your body is going to go through. There's going to be a lot of swelling. So it'll take time for you to have the final results. Initially, it might look like you're having some scar tissue. It might look like you had surgery, but as time goes on, you will see that all of those things go away.
Right. And we're seeing that now, right? Like the minimal effort look, right?
Yes.
So I think what's really interesting, right, is in the last decade or two, we've really gone through the era of people kind of experimenting in plastic surgery and plastic surgeons as well, right? The trends, and we're kind of riding that tidal wave. So that look was very different 10 years ago than it is today. And so the minimal effort look is less is more, right?
Absolutely. That's the new trend. That's in the past couple of years. People want the more natural look, they're less well done. Remember 10, 15 years ago, people wanted really large buttocks and hips, and they wanted really narrow waist. Now they want very proportional, very natural.
Right. And I love it. I think people are finally adapting to having the best version of themselves, having the best body and version of their body. So that's a really awesome thing, right? That's kind of transitioning in this industry.
That's great. It's very refreshing.
Yeah, absolutely.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. contact us today at 424-465-3800. That's 424-465-3800.
Okay, myth or fact? The emotional and psychological effects of surgery can be profound, positively affecting confidence and self-image.
That's a fact. I've seen some incredible changes in patients' psyche and patients' emotional state. A lot of times they said, all my life I've been living with this guilt and this feeling of not being myself. I have extra skin hanging from my belly after having children, or just because everyone in my family has this kind of thing, and I've exercised and I've dieted. I've even had patients who were trainers, bodybuilders, they were part of Marine Corps, and they said, there are these fat pockets that I can't get rid of, or my skin stretched after having kids, or my breast got saggier after breastfeeding. And getting their body back to how it should be, or how it used to be, is so powerful and so instrumental in helping them improve their self-esteem, self-worth, and self-confidence.
So yeah, that's actually really interesting, because what I find really fascinating is that patients will often attribute a surgery or a procedure like having excess skin removed as a chapter of their life, or as a period of their life that they've gone through, and it's a journey that they describe. And I really think that that's very accurate. I think, having had my own procedures done, you're like, wow, that chapter of my life like really made a difference in having this procedure done, and for the positive, for the better. Yeah.
Yes, absolutely. And you've heard me say this to patients. People don't tell you that when you have children, when you get pregnant and breastfeed, your body is going to change, and you're going to have all this extra skin and sagging breasts. And they tell you about all the pain you're going to go through during childbirth, but never how your body is going to change. And then afterwards you realize that, and you say, well, I didn't know this could happen. Can I get my old body back?
Right.
And I tell them, well, yeah, you should have your children pay for it in the future.
They owe you some residuals or something.
Yes.
Absolutely. Wow.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Okay. Myth or fact? You can surgically fix poor lifestyle choices.
That's a myth. Surgery is just to sculpt you and fine-tune you. If you're not eating healthy, if you're not exercising, if you don't have a healthy lifestyle, you actually can get complications from surgery. You're not going to heal well, and your results are not going to be long-lasting. So plastic surgery is never a replacement for a good lifestyle.
Yeah, absolutely. That absolutely makes sense. And you can't it's not just a one-stop shop all the time, right? It's something that requires effort on both ends, and it's a holistic piece of the options provided, right?
Yes.
Yeah, absolutely.
Yes, exactly.
Yep. Okay. Myth or fact? Once you have plastic surgery, you have to keep getting it.
That's a huge myth. So a lot of people say, well, I don't want to get plastic surgery because I'm afraid I'm going to get addicted. Addiction is a dependence on something, which means if you are not getting it, you're just you're not feeling well, and that's that can happen with anything. It can happen with exercise. It can happen with food, with shopping. But generally speaking, plastic surgery is not something that's addicting. It's a lot of times what happens is people get one plastic surgery and they see the results and they see the improvement, and as time goes by, they see how aging is changing their body, and they're not afraid of surgery anymore, and they also have done their research and they know the solutions, so they want to get additional surgeries. Obviously there are people who are addicted and they're getting their fourth facelift when they're 50 years old, and we refuse those in our practice, but those are far and few in between.
Wow. Yeah, that absolutely makes sense.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Okay, myth or fact? Recovery from plastic surgery is long and painful.
That's a myth. A lot of times patients recover very quickly. They can go back to work after a couple of days, and we have many different tools, many different types of medications that we can give you that can take away the pain without giving you too many problems, without making you too loopy. That's one. The other is there are only a few surgeries that have a longer recovery. Most of them have very short recovery. You can be back to your regular life quickly. And I actually encourage all of our patients to get back to their regular activities as soon as possible, because that improves their healing.
Yeah, that makes sense. Yeah, having had procedures done myself, I always tell people it's not as bad as you think. Surprisingly, I think more than half of it, like 80-90% of it, is just the general fear of what it's going to feel like versus the actual 10 or 20% of what it actually feels like.
Yes.
Yeah. And having a great board certified plastic surgeon definitely helps with that journey, but you're absolutely right.
Yes, and also you want to go to a plastic surgeon that has good office staff that will walk you through and help you throughout the process. For example, when our patients get surgery, afterwards, Heather is always checking up on them, texting them, calling them, telling them, oh, send us pictures. Is there anything that you're worried about? Now it's time for your lymphatic massages. Don't forget about this medication. Do you need refill? And that is an integral part of your process and journey. So it's not just your surgeon as much as I would like to think it is, but it's the whole team. So if you want to know more, call our office at 424-465-3800. That's 424-465-3800, and you can talk to Heather all you want about all kinds of questions you have.
Yeah, absolutely. Yeah, we've heard stories, right, where patients have had a procedure done in the past and they couldn't get a hold of their doctor. There was no night nurse to provide any support. And when you have a surgery, that's really scary. You need to know that you have a doctor, you have a team, or that doctor has a team that you can rely on, that they're going to answer your phone call at 1-2 o'clock in the morning, right?
Absolutely.
Yeah. So that's interesting because people do come across that.
Yes, and that's unfortunate. But after your surgery, you can get a hold of us 24/7 with any questions, any issues. We'll get on the phone with you. Sometimes we may Zoom or FaceTime just to check things, but you should never be left alone after your surgery.
Right. Absolutely. Okay.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Okay, myth or fact? Many procedures can be performed in an outpatient basis, allowing patients to go home the same day.
That is a fact. And actually, most procedures in plastic surgery are done in an outpatient basis, and they go home the same night. And I want them to start walking the same night because that helps them heal faster, prevent complications like blood clots in their legs, pneumonia, fever, and that sort of stuff. So many procedures in plastic surgery are done outpatient with a short surgery time and a short recovery.
That's good. Yeah, that's really helpful to know because I think most patients' fear too is that they're going to be in a hospital overnight or they can't move the entire night. And so there's this fear and this anxiety around, am I going to be completely out for 24 hours, right? So you're always pleasantly surprised. You'd be like, no, you're actually going to be up and walking around later that night.
Yes, and in fact, anytime you have surgery with me, I always make sure to see you the next day, because I want to bring you into the office and make sure things are okay, but also to empower you to realize that, oh, I can actually get out of the house, I can actually move. And that once you get that momentum, you're much more likely to actually move around and get back to your regular life.
Wow, yeah, that makes sense.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
Okay, myth or fact? Smoking and certain medications can increase risks during and after surgery, and patients are advised to avoid them.
That is a fact. Smoking cigarettes or using anything that has nicotine, such as vaping, nicotine gums, nicotine patches, can impair your wound healing ability, and that's because nicotine constricts your blood vessels. You're not getting enough blood flow to your incisions, and you don't heal. You end up getting infection. Your incisions can open up. That's one. Two, some of the medications, for example, phentermine. If you take that too close to your surgery, then during anesthesia, your blood pressure can actually drop and it can be very hard to control it. So we always tell patients to stop taking that a week or two beforehand. Another one is Ozempic or Mounjaro. They slow down your stomach emptying. So if you take it too close to your surgery, you can aspirate during anesthesia, which is very dangerous. That's why we tell you to stop it a week or two before surgery.
Yeah, that makes sense. We've gotten that so much lately with the Ozempic craze, the tirzepatide, the semaglutides, all that, the GLP-1 indicators. Yeah, absolutely.
Yes, and we're gonna have an episode on those later.
Oh yeah, I love it. Okay. Myth or fact? Breast implants need to be replaced every few years.
That's a myth. Generally speaking, if you have not had any problems with your breast implants and they haven't ruptured, you're not having capsular contracture, we tell you to keep them, not touch them, not bother them, and just continue your routine monitoring. If you run into any problems, for example, if as a result of aging, your breasts start to sag, or the implant leaks or ruptures, or you get capsular contracture, which is hardening of the shell around the implant, then we tell you that we suggest replacing the implant. But that's not very common.
Yeah, that's a big one. I think a lot of people call in and ask that and are afraid to get the procedure sometimes because they feel like, well, if I get it now, then I'm just gonna have to keep replacing it over and over and over again. But that's not necessarily true, right?
Yeah, that's not necessarily true. We've had people who had the breast implants for 20 years, no problems, and they still have it, and we tell them don't touch them.
Right. That's so helpful.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Okay, myth or fact? Facelifts are only for older people.
That's a myth. Recently, there's been a trend towards younger patients getting facelifts just because they don't want to wait till there's a significant change and have a drastic surgery. So it's more of kind of upkeep. So now there's mini facelifts or ponytail facelifts, and those are to to prevent or decrease all that sagging of the face. And a lot of patients in their 40s, 30s, or even early 30s who just because of their genetics, they started to age quicker or earlier, now are getting facelifts earlier.
Yeah. I hear about that so often now. Yeah, the ponytail lift is like one of the number one procedures that's really rapidly growing in the industry. And yeah, everybody's face is different, right? To each their own.
Yes.
So yeah.
Yes, and it's very genetic. You know, a lot of times you see people who are 70 and they look like they're 50 just because of genetics. And vice versa. There are people who are 30 and they look 50.
Right.
Yeah. So we help you get to look like your age or better, or look good for the age you're at.
Right. Absolutely. I love that. Okay. Myth or fact? Non-surgical options such as fillers and Botox are popular and can be effective for certain concerns.
That's a fact. A lot of times, as time goes by, we get some hollowness in different areas of our face just because some of that fat shrinks or they move around. So things like fillers can replace that lost volume. Things like Botox can help us prevent that frowning or having those wrinkles and those skin memory lines, and keep us looking fresher for our age and not having all those telltale signs of aging.
Yeah, absolutely. It's that's another thing that's been introduced in the industry, right? And rapidly growing. Like, we have so many different portfolios of fillers and Botox. Now you have things like Sculptra. So there's a lot of different options that can really help to just bring back the volume in the skin and in the face.
Yes. Unfortunately, they have very minimal side effects. They've been used in millions of people, millions of times, and they are very safe if done by the person that has proper training and in proper facilities, not like people who get it done in a basement or in a hotel.
Right.
But yeah, if you have any questions about those or you want to get any fillers or Botox, call our office at 424-465-3800. That's 424-465-3800.
Great.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Okay, myth or fact? Many procedures are covered by insurance when deemed medically necessary, such as reconstructive surgeries.
That is a fact. So some surgeries are covered by insurance. For example, breast reconstruction. Women who've had breast cancer and they had their breast removed, reconstructing that, putting implants or using their own tissue to reconstruct that breast is most of the time covered by insurance. In fact, it has to be covered by insurance. It's a law. Sometimes some insurances can give pushback, but it will be covered. Another one is breast reduction. If women who've had large breasts for many years are having shoulder pain, back pain, and they've tried all kinds of treatments like pain medications, physical therapy, weight loss, and that hasn't helped. A lot of times insurances do pay for their breast reductions.
Yeah, that's so good to know. I have a lot of family and friends that ask about this, and we do get patients that call in. Where does somebody start with something like that? Do they go to their general physician? Where do they start that process?
It's best to start with your plastic surgeon. You can come to us and we'll evaluate you. We'll first even tell you whether there's any possibility that you'll qualify for this kind of a reimbursement by insurance. And if you do, then we can start the process. For example, if let's say you haven't tried any other modalities, we'll tell you, okay, your insurance wants you to try physical therapy or over-the-counter medications, and we'll guide you to the right direction, and then we can counsel you as to when to come back if you have not gotten results. So the best is to start early and call our office.
Awesome.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
Okay, fact or myth? Plastic surgery is the same as cosmetic surgery.
That's a myth. Plastic surgery is a blanket term for any cosmetic surgery, any reconstructive surgery, burn surgery, anything that has to do with your skin and its contents. That's what a plastic comes from. The name, that's what the name plastic comes from. Plastikos in Greek, it means moldable. So we do burn surgeries, we do reconstructive surgeries such as abdominal wall reconstructions, breast reconstructions, wound reconstructions, wound care, and also restorative reconstructions, as well as cosmetic surgery.
Yeah, and sometimes, right, like a mix of both is a really good option too.
Absolutely,
Yeah.
yes. Sometimes it's a mix of both. For example, if women who've had one breast that's been removed due to cancer, we reconstruct one of them and we make it look natural and appropriate, and a lot of times the other side is sagging, so we lift that breast and do a matching procedure.
Yeah, and think of like how transformative that is for somebody, right, that's undergone that experience. Yeah,
It really is, and like I mentioned, that happened to my mom, and it was life-changing.
Wow, so glad that that's available.
Yes,
Yeah.
fortunately.
Okay, myth or fact? Your surgeon can predict your results.
So that's a fact. We can predict your result within a certain margin of error. We can tell you you'll most likely have this kind of result. We just can't tell you how exactly it will be, because it's not like clay that we make it into whatever shape we want.
Right.
There's going to be a lot of healing and a lot of your body's response. But within a certain degree, we can predict your results. And you've seen me talk to patients and show them before after pictures of other people who were similar to them, and tell them, well, this is the kind of result that you could expect. And I'm always honest, because it's very important to set those expectations very realistic, because you don't want to come in and be promised one thing and then get another thing.
Right.
I always say we're not car dealers.
Absolutely, and we wouldn't want to be, right?
Nope, we don't.
Yeah, I think that's really interesting, because I think the biggest concern people have, especially with like a liposuction procedure, is that the fat go exactly where you want it to go, right?
Mm-hmm.
You're putting it there to a degree, but you always say something really interesting about the fat survival rate, right? What is that?
So usually, let's say when we do a fat transfer to your buttocks, breast, hips, about 40 to 50% of it survives, and the rest of it gets absorbed to your body. So we do put a little bit extra, but there is only so much that your skin can accommodate. So we can predict to a certain degree what your results are going to be, but we cannot know exactly.
Right, that makes sense.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
All right, and that concludes our time together this week. Thank you for tuning in. I hope you all enjoyed this second episode of Myth or Fact Show. Make sure to tune in every Sunday at 7:30 a.m. on Go Country 105 FM to learn everything you want to know about plastic surgery. Whether you've had it done or you're considering having a procedure done. We have many more exciting topics coming up. As always, if you have any questions or if you want to book a consultation, give us a call at
424-465-3800. That's 424-465-3800.
Make sure to follow us on Instagram at Josh Jacobson MD. See you next time, same place. I'm Dr. Joshua Jacobson, your beauty architect. Actually, my mom is a hairstylist, and she does talk about that. It's kind of goes along with the appearances, and so I talked to her about hairstyles and hair colors, and she's told me about that you can't suddenly go from one extreme color to another.
Right, absolutely. It's a good hairstylist.
Good. I'll tell my mom.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
So our second one, myth or fact, advances in technology have made many procedures safer and recovery times shorter.
Yes, absolutely. It used to be that if you were getting a tummy tuck, you had to stay in the hospital overnight and the next day. That's not the case anymore. We always send our patients home, and we want them to walk from that first night. And a lot of things that have gotten safer are, number one, anesthesia. That has gotten so much safer in the past 20-30 years, and that's because we've added different types of monitors so they can pick up different physiological changes, and that way the anesthesiologist can respond and adjust things so that it doesn't go to the wrong it doesn't go in the wrong direction. So that's one. The other is the medications that we use during anesthesia have gotten so much safer, so much better, and a lot less side effects. That's number two. So, and number three, the surgeries have gotten a lot safer just because we've found out and we've figured out what are some surgeries that have more complications, so we stay away from them, or how to avoid those complications. For example, a case that comes up a lot is BBL, Brazilian butt lift, which is basically transferring fat to the buttocks and hips to give more volume and improve the shape. In the beginning, there were a lot of deaths because of fat getting into these large blood vessels and going to their hearts and stopping their heart.
Yep.
And we realized that that happens when we inject fat inside the muscle, inside the gluteal muscles, because there are a lot of big blood vessels there. So now we do not inject fat in the muscle. We inject it above the muscle, under the skin. And if you do that, you're 100% safe. So that's why a lot of these procedures have gone so much safer. And personally, I am very, very cautious, very, very worried about patients' health, patients' well-being, because at the end of the day, it's an elective surgery. It's cosmetic, so you don't want any bad complications to happen. That's why if something is not safe, I either tell them I'm not gonna do it, or I have to break it up, or you have to lose weight, or you have to change something. You have to see your doctor to adjust your medications. And obviously, I've lost clients because of that, but that doesn't matter to me, because all I care about is not to harm anyone.
Right. Safety first. That's
Yes,
an
absolutely.
absolute priority. Yeah, fantastic.
Absolutely.
Well, that's good. Yeah, because I think the biggest fear that we get from a lot of people that, ask more information or just have general questions is the anesthesia part of it. And they don't really know what to ask, or they just have that fear, and they call in and they say, hey, I really want to do this, but I've never had a surgery before in my life. What's it like going under? What's the likelihood that something would happen? And so it's really important to be educated and to have a board certified plastic surgeon who is skilled in this area, right?
Yes.
So yeah, that's a big concern.
Yes, exactly. And you are right that a lot of patients have worries about anesthesia. Now, fortunately, in the United States, there are so many regulations, and anesthesia has become so safe that they actually say you are more likely to get hit by a car and something really bad happen to you than actually having a really bad complication from anesthesia.
Oh, wow. I didn't know that.
Yeah.
Yeah, that makes sense. Very, very cool. Well, thank you. That's very, very helpful, and I think that would help a lot of people to lessen that anxiety, behind some of those thoughts.
Yeah, and what you have to make sure is, one, your surgeon is board certified by the American Board of Plastic Surgery. That is the only board that is legitimate for plastic surgery. Other boards are not. other boards are not accepted in this field. So only American Board of Plastic Surgery is accepted. That's one. The other is you want the surgery center to be accredited by a national accreditation organization. There are different ones, Quad ASF, AHS. So always ask your surgeon if the surgical facility is certified or not.
Yeah. Actually, that's like the number one question I get is what's the difference between a plastic surgeon and a cosmetic surgeon? There's a lot of confusion out there about the two, and there's a very big difference, isn't there?
Yes, there is. So any doctor can call themselves a cosmetic surgeon. The medical degree that we get, it says physician and surgeon. So you could call yourself a cosmetic surgeon even if you're an OB-GYN, even pediatricians. Pediatricians do liposuction and
so you could be a pediatrician or a gynecologist or like a dentist and still do something like liposuction.
Yes.
Wow.
Yes.
I don't think a lot of people know that.
And so unfortunately, they call themselves cosmetic surgeon. That's legal to call yourself that,
right,
but it's very misleading because they don't have the right training. And, there have been instances of, actually recently, a few months ago, a pediatrician was doing liposuction on a patient, and unfortunately, the patient died during the surgery.
Ooh.
Yeah. However, you can only call yourself a plastic surgeon if you've had the plastic surgery training, and that's part of that plastic surgery training is reconstructive, aesthetic, cosmetic, all of that. So it's very important for you to ask your surgeon if they are a plastic surgeon or just a cosmetic surgeon, and if they are certified by the American Board of Plastic Surgery.
That's amazing. I did not know that.
And a lot of times when patients call our office and ask, and we kind of inquire, when we ask them, they say, well, I got a really cheap deal down in San Diego, and we looked up the person, and it was a dermatologist that was going to do lots of liposuction for very cheap. And we always send them this link that they can check and see if the person is certified by the American Board of Plastic Surgery. If you guys want to check that and you want to talk to Heather, she can direct you to that resource. You can call our office, 424-465-3800. That's 424-465-3800.
Yeah, absolutely. I'd love to answer some of these questions, and please give us a call.
Yeah, give her a call. She's not going to charge you.
Conversations are always fun and free.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Okay, number 3, myth or fact? Plastic surgery is purely cosmetic and unnecessary.
So that's a myth. A lot of times there are surgeries that are reconstructive. For example, my mom had breast cancer. She had mastectomy. She had her breasts removed. And initially she didn't have reconstructions, and she always felt very self-conscious about herself after the surgery. She would always tell me, oh, I can't wear any of these clothes. Now we're going to this gathering. It's going to be awkward. And then when I went to medical school and I started learning about different surgeries, I saw a breast reconstruction, which is basically placing implants in the breasts of a woman who doesn't have breasts anymore to give them breasts again. And it was very simple surgery, very minimal complications, and I told her to do it, and she got breast reconstruction, and she was so happy. It really changed her. It gave her back that sense of womanhood. And that's one of those things where it's not vanity, it's really giving back a part that you lost. Kind of like if you lost a finger, yes, you can go without that finger, but you need that for function.
Right.
So that's something that a lot of people don't know. Another example is burns. People who've had burns and they're disfigured, we help them get back to a more normal shape. Another example is during a tummy tuck, we sew the abdominal muscles together because they get stretched during pregnancy and childbirth. And that basically weakens your core muscles, and it can cause a lot of back problems. As we know, if your core is weak, you're going to have back pain.
Right.
So when we sew those muscles back together, it strengthens your core. It makes it tighter, kind of like when you stretch a hammock, it gets more tight. And a lot of times patients say their back pain goes away. Speaking of back pain, a lot of women all of a sudden during puberty get very large breasts, and they weigh really heavily on their shoulders, on their back, and they get a lot of back pain. I actually had a patient who said she was having sciatic pain from her heavy breasts. Very young, very nice woman, 25 years old, and we did breast reduction on her and took out some of that extra weight, lifted the breast, and her sciatic pain was gone.
Wow.
So that's another
amazing.
example. Yeah.
Yeah, that's actually a really good point, because a lot of times when I talk to patients that, you know, especially in regards to the tummy tuck, it's that excess skin that's kind of hanging from, you know, having kids and having pregnancies in the past. On average, what would you say, you know, the amount of weight is that comes off when that excess skin is cut off from the tummy tuck procedure?
Yeah, so we actually weigh that extra tissue after surgery. Usually it's anywhere from 5 to 10, 12 pounds that comes off.
Wow, that's significant. And you know, that's interesting, because I always tell people, I'm like, when they're kind of on the fence about it, you know, I'm like, imagine you're carrying that 5 to 15 pounds around right now, right? Mm-hmm. And imagine if you walked around all day with a 5 to 15 pound weight in front of you for 24 hours. Mm-hmm. And then somebody finally comes to you and says, let me take that weight for you. Mm-hmm. How good that would feel, right? You'd feel so relieved. So exactly. You're right. A lot of patients have expressed that after having that excess skin removed, that they feel so much relief in their back pain, and it's life-changing.
Yes, it is. And again, plastic surgery is not all just cosmetic vanity. A lot of it is just to give you back the regular, normal body shape and form.
Right. Wow, that's amazing. Okay. All right, number 4. Myth or fact? Liposuction is a weight loss solution.
Myth.
How come?
So liposuction is a body sculpting procedure. It's to shape your body. It's not weight loss. Let's say if you're 50 pounds overweight, we're not going to be able to remove all that weight, because a lot of that is fat that's around your intestines, which is what we call visceral fat. That fat we cannot access, we cannot touch, no one can. If you touch it, if you try to take it out, you get huge complications. So also you have a lot of fat in between the muscles if you're overweight. So if your weight to height ratio, your BMI is significantly high, you need to try other avenues of weight loss, which we'll talk about in one of our shows. And once you get to a more normal weight for your height, then we could do liposuction to sculpt your body, take out some extra fat here and there that's giving you the shape that you don't want. Right. And a lot of times these are areas of fat that are stubborn. They tend to be genetic. You know, people say everyone in my family has this little bit of belly fat, or everyone in my family has these big thighs, or fat in our chins. So that's what we really address during liposuction.
I see. Okay, yeah. I always like to use the analogy, like, your fat pads in your body are like puzzle pieces, right? And as you mature and as we age, those puzzle pieces start to shift and start to move to different areas, right?
Yes.
Which is why as we get older, we start to see that maybe transfer to our hips a little bit more, transfer, you know, you feel like you had a really nice bottom shape before, and now maybe just after having a few pregnancies, those pieces have kind of shifted, those fat pads have shifted. So
yes, exactly.
Very cool. Okay, number 5, myth or fact? Surgeons typically recommend waiting for specific periods between procedures to allow for proper healing.
Yes, that's very true, because, you know, I always tell patients, We're not IKEA. You don't come here and we just attach things and screw things and then you're done, you know?
Right.
50% of the work is what we do. 50% is what your body does, the healing response. And that healing response is very important. If you overburden the body with all that trauma, it's not going to be able to heal properly. So we need to give it some time, and that's why I don't do too many surgeries at once on one patient. So usually most procedures we like to wait about a month and a half in between at least.
Yeah.
And that's because that gives the body to that gives the body time to recover, decrease the risk of blood clots, and improve your body's healing ability.
Right.
Sometimes we may tell you need to wait longer, for example 3 months, 6 months, and that's because, let's say, there's scar tissue that's forming in an area and we want that to kind of finalize. For example, there are patients who need liposuction in their abdomen, an extensive amount of liposuction, and a tummy tuck. So what we tell them is we'll do some of that liposuction first, and then a few months later, about 5-6 months later, once the scar tissue has matured, then we do a tummy tuck.
I see. Right. That makes sense.
And that concludes our time together for this week. Thank you for tuning in, and I hope you all have enjoyed our Myth or Fact show today. Make sure you tune in every Sunday at 7:30 a.m. on Go Country 105 FM to learn everything you need to know about plastic surgery, whether you've had it done or you're considering having a procedure in the future. We have many more exciting topics we're going to be covering on air. As always, if you have any questions or if you want to book a consultation, give us a call at 424-465-3800. That's 424-465-3800. Make sure to follow us on Instagram at Josh Jacobson MD. See you next time, same place. I'm Dr. Joshua Jacobson, your beauty architect.